Hello, I'm Dr. Dilip Gude, physician and diabetologist, Yashoda Hospital, Somajigoda, Hyderabad. So let us discuss about stroke, the paralysis attack that one gets, and the causes leading to it, the reasons why one gets this particular paralytic episode. So paralysis is nothing but decreased blood supply to areas of the brain that control, most of the body basically. So if you have to lift your hand, it means that the corresponding part of the brain, say for example on this side, if your left hand has to go up, your right side of the brain, there is a center that tells you to lift the hand up. So in such a way, the whole body is wired to the brain. So when brain gets, say, blood supply defects, as in blood clots, or sometimes rarely, actually 85% of paralytic attacks are all ischemic strokes, meaning there are blood clots. But then there are 15% where there is hemorrhage, as in blood, small micro, arteries and all, they rupture, and then there is bleeding that occurs. So both cause this paralytic attacks. Now let us just discuss and see why anyone gets paralytic attacks and why these ischemic or thrombotic strokes occur. So thrombosis is nothing but a blood clot basically. So it can arise from the heart, it can arise from the neck part as well. There are two arteries basically, one artery that goes up which branches out into two, and then it supplies the brain on both sides, the right and left, common carotid artery and then internal carotid artery. So when there is a plaque here, when there is a cholesterol-laden plaque that can chip off and it can rupture and go higher up and then form a ischemic stroke. Likewise, there can be blood clots in the heart which can actually go higher up in the to the brain and cause these blood clots. Rarely, people who have a hole in the heart, they have blood clots in the legs and all, they can actually go higher up. From the right side, the clots can go to the left through the hole and then cause ischemic strokes as well. And then things like AF, that is atrial fibrillation, which is nothing but a irregular heart beating rhythm, in which case there is an increased risk of blood clots in the heart, which actually go higher up and cause stroke. So there is a 15% risk of 15 to even 20% risk of AF, that is atrial fibrillation, causing paralytic attacks. So why is it important to understand a paralytic attack? Because time is tissue. So the earlier you act, once you understand there is some kind of a numbness on one side of the body or one side of the face, then you have to, and if you have risk factors like say diabetes or hypertension, if you smoke, for example, the chances of these paralytic attacks go very high up. And in that case, you will have to act very, very fast, get help immediately. If possible, get a CT scan, because in CT scan, it takes about 6 hours for a blood clot to actually appear. But then if there is a bleeding, then you can find it within minutes. So CT scan helps us to identify, because treatment for a clot is different, diabolically different, and treatment for a hemorrhage, that is bleeding, is different, because in fact they are both opposite. You try to give a blood thinner when there is a blood clot, and then you try to minimize the bleeding by anti-edema measures when there is a bleeding. So when you give a lysing blood thinner in a hemorrhage, you are actually worsening it. So which is why we do the imaging, that is a CT scan of the brain. But in some centers, in higher centers, basically, you can do a 2-minute diffusion-weighted MRI, which picks up ischemic stroke much better than the CT scan. So if your entire stroke unit, your neurology, neurosurgery unit is well equipped, if the neuro ICU is well equipped, then most centers do this 2-minute diffusion-weighted MRI, and then quantify the severity of these paralysis attack, and then also helps us in diagnosing is it a bleeding or a clot, because as I said, the treatment is completely different. And if there is a big blood clot, we might need to give an injection, that is systemic thrombolysis, which can help improve probably completely. There are times where we saw 100% resolution of the clot and the 100% U-turn of the paralytic symptoms. That is a hand that was completely numb and it has no power at all. We can't quantify the muscle strength in a paralytic patient by 0 to 5. So when patient can have full power, then that means that patient has recovered fully well. So in a paralytic attack, if you can act as fast as 4.5 to 6 hours, if you are going to give a thrombolytic agent, you may get very good results, probably from 80 to even 100%. But since I said time is tissue, if you delay it, then the chance of recovery starts coming down progressively, and the later it is, say 12 hours, 24 hours or later, you really cannot give a thrombolytic agent because the risk of bleeding is higher when you give a thrombolytic agent. So it is really important to understand that in paralytic attack, time is very, very important. Rush to the nearest possible center, get imaging done, and then get help with your blood thinner and then cholesterol lowering medicines, and make sure. Sometimes if blood clot is bigger, you may even have a seizure, a fits like episode. So all these are to be considered, because blood clots can be small, very small, or actually very, very big. In very big clots, probably you might even require a surgery to be done, because you need to allow for the edema, because there is going to be a lot of swelling in the rest of the brain. So if you don't allow that swelling by opening, making a small window, then this edema itself can cause tonsillar herniation, and it can probably even lead to death. So likewise, in a hemorrhage, when there is a bleeding that occurs in the brain, the symptoms may be similar, but the treatment is diabolically different and opposite. So you might need to give medicines to decrease the swelling, basically like mannitol, for example, glycerol, and 3% sodium chloride, and then hypercarbia. If patient is ventilated, you might need to allow some degree of carbon dioxide to retain. So all these measures will help you minimize the swelling of the brain. And then if it is too large, there may be a need for a EVD, extraventricular drain, where you can actually minimize the pressure of the brain, and that may be life-saving sometimes. So sometimes you might need to do both craniectomy, open a small window in the skull, allow for the brain to expand, and you can probably also do EVD, that is extraventricular drain, into the abdomen, where the higher the pressure of the CSF, it can actually be brought down, and probably can help in saving the patient. So do not take paralytic symptoms lightly, because they may be completely permanent, meaning the power can actually become zero. You might not even be able to move your finger. So especially if you have time, and if you can reach a higher center very quickly, please do it. And especially if you have risk factors like diabetes, hypertension, if you smoke, try to make sure all these are in a very good control. And people with symptoms like facial droop, or weakness, then numbness, then loss of loss of consciousness, having fits and all these in a patient with diabetes, hypertension, smoking and all, one needs to strongly understand that there may be some degree of paralysis that is setting in, and immediate brain imaging is required, and appropriate attention needs to be given. Thank you.